Can people hear me?
Yes. Yes. We can hear you. We can hear you.
Yes.
You can hear me?
Yes.
Okay. I'm prepared to start whenever Lavin gives me the word. I won't necessarily finish when she gives me the word, but I'll start when she gives me the word.
You can start.
Okay, thank you. Well, good afternoon. This afternoon, I signed a document declaring a state of emergency in the City of Toronto after receiving advice from our Chief Medical Officer of Health and the Office of the Emergency Management. Through my office, I've also been in communication with the members of Toronto City Council and have spoken personally to both Prime Minister Justin Trudeau and Premier Doug Ford. J'ai déclaré aujourd'hui l'état d'urgence sur la ville de Toronto après avoir reçu les conseils du médecin chef de la santé et le bureau de la gestion des opérations d'urgence. Par le biais de mon bureau, j'ai aussi pris contact avec les membres du conseil municipal ainsi que le Premier ministre Justin Trudeau et le Premier ministre de l'Ontario, Doug Ford. We know the number of COVID-19 cases continues to increase in our city and that the next few days are absolutely crucial in our ongoing efforts to slow down the spread of COVID-19. In making this declaration, I strongly encourage our residents to continue to take every precaution in protecting yourselves and protecting your fellow citizens. Stay at home, stay safe, and only buy essential supplies, for example, once a week. As Premier Ford said last week when he declared a provincial emergency, and he's repeated very forcefully today, we need to do everything we can to spread down, to turn down the curve on COVID-19. We need to do everything we can. This is a battle we must win, but we're only going to win it if we all work together, we all join together to do what's right and to do what has been advised to us by the health experts. We have to take action, all together and now. This decision was not taken lightly. At 10 a.m. this morning, I had a call with Chief Pegg and Dr. Eileen Davila, our Medical Officer of Health, where they recommended a declaration of emergency. They told me that they thought this would help us to maximize the city's ability to do everything possible as quickly as possible to fight this virus, to win this battle. I've always told them, and I've always told the people of Toronto since this began, that I would never hesitate to make that declaration if the recommendation came from our professional city staff and our professional public health staff, as it did today. I then notified both Premier Ford and Prime Minister Trudeau this morning that we would be taking this action. This is all part of an overall collaborative effort with Prime Minister Trudeau and Premier Ford, both of whom I've been working very well with throughout this crisis to date. I've been in frequent contact with the Premier throughout, including late last night, and we've seen absolutely eye to eye, as we continue to do, on the need to take various actions which have been taken to date to protect our people. While I thank the residents and businesses who are listening to public health advice and practicing social distancing, we know from our public health professionals and just from videos and from watching the media that there are many who, for some reason, unknown to me, almost unimaginable, they are continuing to put their health at risk and put the health of our entire community at risk. This is behavior that is selfish, it is unacceptable, and it cannot continue. This declaration sends the strongest possible message that I can, as the Mayor of the City of Toronto, to our residents to stay home and please to change their behavior. I continue to ask all non-essential businesses to close, as the Medical Officer of Health has urged publicly a number of times, and as the Government of Ontario is now ordering. I fully support the Premier's announcement today. I believe a province-wide closure order for non-essential businesses is the right approach. I understand, as I know he does, that when you do this kind of thing, that it unintentionally creates some hardship for people. But the clear and only intention as we make these decisions is to help the public good, to get us healthy again as people and as a city, so that we can get back to our lives and get back to the success we were enjoying before this all began. I have been clear that I will also support further recommendations and orders from the Medical Officer of Health and from the federal and provincial governments if people do not comply with the need to stay home, the need to distance themselves 2 meters from others, and the need for those who recently have traveled to self-isolate. While the declaration doesn't change the Level 3 status of the city's Emergency Operations Centre, it does provide city staff and me with the necessary flexibility needed to access resources in a more timely way, to be flexible so that we can continue to keep the city functioning and safe and as healthy as possible. Right now across Toronto, our healthcare workers are confronting the reality of COVID-19. And I am making this emergency declaration in support of them and all city workers and first responders focused on this crisis to make sure that we back them up in saving lives, in flattening the curve, and in protecting our healthcare system. I know this is an incredibly tough time for Toronto residents and indeed for people across Canada and in many parts of the world. I want people in Toronto to know that we are doing everything we can at the city to fight this virus while continuing to deliver the essential and critical services that Torontonians rely on, as well as to determine together with the other governments ways in which we can support people in their daily lives, including with regard to the impact this is all having on their finances. I remain confident that we will get through this pandemic by continuing to work together and by making sure that everyone, without exception, is following the advice of our public health professionals. Just as generations before us faced tough times and overcame them, we will get through this, and I know there will be better days ahead. The amount of time involved in this, while it seems long, and it is long, and it's painful in many respects, is a very short period of time in a lifetime, in a career, and in the life of a family. And so that's why we have to get through this as fast as we possibly can, so that we can get back to family life, get back to the work life, get back to normal life, and get back to the life that we all are so privileged to enjoy here in the City of Toronto. And I strongly believe that the actions we are undertaking now, together with those of the other governments, are actions that we are urging all Torontonians to take as well, because I believe in my heart, and I believe based on the science and the professional advice we're getting, that it will make a difference on bringing this sad chapter to an end as quickly as possible. Getting to that point, getting to the point where we can tell people that it is over, is my sole focus. Supporting our people, delivering services, helping businesses survive, having a plan in place and drafted up for after this horrible chapter. These are all the things that we're working on. But I also want to make sure that I offer some hope. Offer some hope, because I think people increasingly are feeling quite hopeless about all this. We're strong. We're admired around the world for the way in which we support each other as a city. Let's double down on that now. And that not only means providing some support or looking in on or providing a bit of extra care to someone who's a neighbor, a friend, a relative, an elderly person, or someone like that. It also means strictly following the rules, looking out for each other, looking after each other, but doing so as well by following the rules that have been set out so clearly and so unambiguously by our professionals, our healthcare professionals. Let's do that for each other. But even more so than that, let's do that for the city that we all love so much. Thank you for your attention. Questions?
Okay, we'll do questions inside City Hall first. Go ahead.
Hi, Mayor. Jamie Goodfreund from CP24. With non-essential businesses being ordered to close, there's a lot of focus on construction workers. In fact, a bunch of them walked by me on Yonge Street while I was reporting today, and they had a message for you, was to shut down the construction sites. They don't feel comfortable, and many would agree that building another condo in the city or another plaza or another office building is not considered essential. Would like you to respond to that.
Well, first of all, I would say that this morning I talked on the telephone through teleconference with union leadership, but also with about 20 members of the industry, because I was really talking to them and convened them in response to a teleconference I had with union leaders last week, in which they expressed grave concern about the safety and well-being and health of their members. I will say that what I heard this morning was not a unanimous opinion from the industry, and in the sense that some felt there should be a complete closure for a variety of reasons, starting with health and principally health, but also going through other difficulties they're having right now. Others felt it should be a case-by-case basis, and other people felt we should, more or less let the trend line, which is a positive one in terms of employers and contractors taking positive steps to further protect the health of their workers, continue to take its course. So I'm going to put together all of the summary of that advice and discuss it with the Premier, because this is very much a part of, I know, the deliberations he is undertaking. But I will just tell you, my number one priority, above and beyond anything else, is the health of those workers, at the same time as I don't want to see more of them than absolutely necessary ending up out of work because of steps that we undertake. But I will be talking to the provincial government about that and summarizing for them what was a very excellent and constructive conversation I had this morning, both with union leadership and with leadership in the construction industry.
Thank you, Mayor. And my follow-up question is in regarding the advice from public health officials. When it comes to people walking out, going for a walk, it's been advised that that seems to be okay, but we're obviously seeing far too many people bringing their kids to playgrounds. And what caught my attention over the weekend when I was going for a walk along the Martin Goodman Trail is seeing a group of young men playing basketball, a pickup game, getting sweaty, passing around a basketball. And I was wondering, when it comes to the public playgrounds and the public basketball courts, would it be a good idea if maybe we completely shut them down, board up the basketball nets? Because at the end of the day, that was seriously concerning. And a lot of people feel that they almost want to snitch on these people and get police to disperse these large groups, or if it's a small group, doing something as irresponsible as playing basketball.
I am in receipt of quite a lot of comments about this too via email and other ways in which people have reaching me. And one of the city councillors actually suggested this very thing, that we should take down the basketball hoops. I'm going to be discussing that, as I did, for example, the situation with our playgrounds with the medical officer of health. And if it's deemed the only way in which we put signage up there, but the city councillor I was speaking to told me that he doesn't think a lot of the people would pay attention to that sign. And I think there's some evidence that he could be right. So I'm going to pursue that, because I think we have to send the message loud and clear in every way that we possibly can. Unfortunately, I'm terribly sorry, just as the weather's getting a little bit better, we cannot have people in close proximity playing these games where people are in physical contact and close contact with each other. Even when it comes to taking a walk, people have to change their habits. And instead of walking down Yonge Street or Bloor Street or the Danforth, walk down a side street. And frankly, if you see your neighbor across the street, wave at them. Don't cross the street. Wave at them and say hi, but stay away from them, because this is just what we're going to have to do to change our behavior for a period of time to put this behind us.
Okay, we have Lauren Pelly from CBC up next.
Can you hear me okay?
Yes, I can, Lauren. Thank you.
Perfect, thank you. Mayor Tory, can you shed a bit more light on what specifically this would accomplish right now, given all the other layers happening with the province and the feds? What would this really do?
Well, we were prepared to move on this morning after I had the discussion with the Chief Medical Officer of Health and the operations people, the emergency operations people. And I think now we're going to see a list of things happening from the province, which is terrific. And I knew they were working on that, but we felt the urgency to move to give us, most of all, more flexibility to make decisions. For example, right now, we couldn't, without this power, put a policy into place as regards playgrounds or city public spaces that would limit the space, or put a limit on the space that should be put in place between people. We couldn't do that. Now we can. And obviously, I said I'm going to be very careful. I'm going to take advice. I'm not going to exercise any powers that are given to me lightly under this declaration. But that's a small example, but perhaps an important one, in terms of saying to people that if it isn't covered elsewhere by other orders coming from other governments, we will say that there are limitations there are boundaries around how close we want people to be or not to be to each other on city-owned spaces. So that's an example. But there's also, I've seen in the whole unfolding of this thing, there are things that come up every morning that you didn't know were going to be happening that morning. And sometimes the machinery of government is just going to function better in responding to those needs, most of which relate to the needs of people, if we have this declaration in place. I'll be very honest with you, because I try to be at all times. Some of these things I could have done without the declaration, but we thought that wouldn't be transparent, and that it was probably also sending a signal, a very strong signal to the people of Toronto, that they must change their behavior, and it further officially and in a transparent way facilitates the flexibility that we need to make sure we can do everything we can to defeat this virus.
And just a quick follow-up. When was the last time the city actually declared a state of emergency like this?
I don't know. You'd have to ask someone else the answer to that question. I know it did not happen during the ice storm, because there was a bit of a discussion, a dialogue at that time between various people, but I don't know.
Okay, Mark.
Mayor, Mark Douglas, 680 News. Pardon, I don't know if you can see it. Pardon the Lysol wipe draped over the microphone. I hope you can still hear me all right.
I can hear you.
The state of emergency, will this allow Toronto Police to enforce some crowd control, to enforce some social distancing?
As you know, the Toronto Police, we had received indication from the province under the legal regime in place that the Toronto Police were going to be principally responsible for the enforcement of all of the orders of the province, leave alone our own orders. And in some cases, it's public health people who follow up on public health orders. But in the case of these kinds of orders about businesses being open or closed and this kind of thing, I think you'll find it will end up being the police, although we are exploring the possibility of licensing staff being allowed to do that as well, because the police have their hands full. But having said all that, the answer to your question is yes, it will principally fall to the police to enforce these things as they unfold, the list coming from the province tomorrow and any orders that are issued today, with the exception of those that would be enforced by public health itself.
Thank you. Follow up then. We recently saw, Toronto saw its first death related to COVID-19. Are you confident the city is prepared to handle more, should it come to that?
I will say the first death was a turning point. There have been a number of turning points as we saw the numbers change and so on, but I think it was a turning point, and it led to some very serious discussions between myself and the Premier and some of his ministers and people in the federal government as well, because I think it was one of those things where, while we were very, very concerned and trying to do everything we thought appropriate in light of the numbers of people that were contracting the coronavirus, the COVID-19, we really, I think, a death, focuses your attention. And I must say, my heart goes out to the family and to the friends and relatives of the person who succumbed. But I think it will have served a valuable purpose for us all in getting us to focus once again hard, as we've been trying to do every single day, on what more we could do to arrest this virus and to make sure that other lives aren't taken. And so I believe we are taking the steps necessary, including what Premier Ford did today, including what I'm doing today, and many other things the Chief Medical Officer of Health is doing. But you know what? The most important actions that are going to be taken, that are going to stop other lives from being lost, are actions that are going to be taken by businesses who can decide, because I think it's not that hard for most of them, that they're non-essential, and for people to decide they're going to follow the rules, they're going to socially distance themselves from others, stay home, stay away from work, and follow the rules. And I think if they do that, that's going to be the biggest tribute we could pay to the poor, unfortunate man that lost his life.
Thank you.
Okay, Brian, Toronto Sun.
Good afternoon, Mr. Mayor. What is the status of the city's safe injection sites? Do they remain open, and will they be declared an essential service?
Well, they have remained open, and the fact of the matter is that what they're doing is saving lives. And if our business, the first order of business we have in government, I believe, as elected officials, is to keep people safe and keep them alive and stop needless deaths from occurring. That's what the entire announcement today is about. That's what the safe injection sites, the supervised injection sites, are about. And so they should remain open as a means of making sure that we can care for people who are very vulnerable. They're people with big issues in their lives. And I think that more than ever, we have, in the case of the homeless, in the case of people with mental health and addiction issues and so on, an absolute obligation to make sure we're looking after them, especially in perilous times. And they also represent a population we've been paying special attention to, because the odds of the virus spreading among some of those populations is enhanced. And so we're paying particular attention to that.
No follow-up. Thank you.
David.
David Ryder from the Star. Mayor Tory, can you please tell us, it's a dramatic move to essentially sideline council and to say it's an emergency, and I, as mayor, I'm going to act alone with my emergency officials. You mentioned about possible moves about people in playgrounds or parks. Can you tell us what you intend to do with these powers? Like, what is on the table at the moment for you?
Well, I think really what we intend to do is to have the flexibility so that when the emergency operations people and the Chief Medical Officer of Health find that there are things we could do to contain the spread of this virus and save lives, that we're in a position to move quickly to accommodate those things if there are things that, for example, the Chief Medical Officer herself or the Chief of Operations at the Emergency Center can't do. And so there are no plans. There's no list of things we're going to do tonight or tomorrow morning. But the idea here on the professional advice, and let's be very clear on that, I got the professional advice that they called me. And I had said that if you ever need to call me, please do, and that I will, 99.999% of the time take your advice, because they're the ones we hire and put in place to provide that expert advice. And that is exactly what I've done today. And then I can assure people, and I think they trust me in this regard, to exercise those powers that are given to me upon advice, as we said in the emergency order. I wrote that in myself. And with due consideration. I think people know how I make decisions, which is carefully and considering all sides and making sure that we exercise great caution in things that affect people's lives, especially when the council may not be as directly involved. But I was talking to large numbers of city councillors yesterday, not about this specifically, but about how we're doing and gaps they see in what we're doing. And I think you'll find the majority of them support this as a sensible thing to do to make sure we have the flexibility as a government to respond to a crisis that is certainly one that is not getting better at the moment.
And just to follow up, I mean, we've seen a steady increase in the number of COVID cases, and we've seen community transmission started. Now we've seen the first death. What specifically was it those two officials said to you that means we have to move to this dramatic new level now? Or not, I know, understanding there's not a change in the level of emergency, but it's a dramatic new stage in the kind of powers that are at your disposal.
It was the trend line of the numbers and the need to sort of get the flexibility to act if we have to now in light of those numbers changing that caused me to not only begin advocacy to the other two governments with respect to us needing to do more. It was also, frankly, some of the television pictures and accounts that I had of people acting as if it was business as usual over the weekend. And I know it was a nice weekend, but, you know, like people just didn't seem to get it, some people. And so all of that put together certainly said to me that when I got the professional advice this morning that it was time to give ourselves that flexibility. It was time to encourage the other governments to act and for ourselves to act, even if they didn't. And I was quite confident they were going to, that it was time to issue this declaration. But as I say, the main pivot point for me was the request that came from our trusted officials, including the medical officer of health, to give ourselves this flexibility so that we could do everything possible to fight this virus.
Haley Cooper, News Talk 1010. Go ahead, Haley.
Mayor Tory, can you hear me?
Yep.
Excellent. So we want to know, you talked about that pivot point, but we want to know what exactly does this emergency declaration mean?
Well, it gives me the authority under the emergency declaration to do anything that the City Council could do. So in other words, it doesn't expand city authorities into areas that we don't have jurisdiction. So the province's order today was very important, and I welcome it as another step alongside what we're doing to make sure that we stop the spread of this virus and get people to, to pay better heed to the instructions and advice they've been given. But it allows me to do that and to have the kind of flexible, nimble ability to change things quickly if we have to, based on the advice that I receive from the medical officer of health or the senior public service or from the emergency operations people. And like many things, I think the prudent approach recommended by them but accepted wholeheartedly by me was to put this measure in place now, as a number of other cities across Canada have done, by the way, and then to be in a position where we can move very quickly without the need to even just have the paper drafted up and brought to me if there's something that goes on that we need to act on. And as I said before, I think people know they can trust me to carry out those very heavy responsibilities in a way that is responsible and that is prudent, and that's exactly what I'll do. But I will not hesitate to act in the best interest of the city. And again, I'm held to account for that. Anything I do, anything that I do by way of exercise of these powers, I will be held to account for that by the people the day after and, of course, at the time of the next election.
And we've been hearing a lot of complaints from construction sites, from workers on those construction sites, that there is not ample social distancing. They're actually working in very terrible conditions given the times. Does this declaration allow you to shut down those sites if need be?
I don't think so, but it may well be the case that the medical officer of health, under one of her powers to issue her own orders, which are not orders that I gain any influence over, because of this declaration today, she may well have that. But I think, frankly, it's best going to be done by a decision made by the province to shut things down for a pause, which is what some of the labor groups have advocated, and to get things fixed on those sites, and to shut it down completely or to take some other action. I will say this. On the call I had today with many members of the construction industry, they acknowledged that some of the work that gets done on their sites, it is impossible to do without people being, as they described it, shoulder to shoulder. And so I think those people were the ones on the call today that were saying probably best we shut it down. Because I asked the question, which many of you would ask, which is, well, if you took the work out that has to be done shoulder to shoulder as clearly being inappropriate in light of the circumstances we find ourselves in with COVID-19, could you continue the work on the site generally? And they said, usually no. And so I think they even were saying in that case, that was among the group that said shut it down. So this is a very complicated matter. We're weighing as well, with safety coming absolutely top priority first, no ifs, ands, or buts, you know, trying to make sure we don't put any more people out of work than necessary, but always placing safety first. So I'm going to have some discussions about the conference call I had today, including the discussions with the labor leaders who, as I said earlier, were prepared to acknowledge that many of the companies, since the time this became an issue, and since I had my roundtable on the safety of construction workers, have taken steps to put proper hand sanitizer, to put more of the hand washing sinks, to find ways to socially distance people. So they've acknowledged there's some progress. I don't want to put words in their mouth, but I think there's a lot more to be done.
Global.
Hi there, Mayor Chris Dunseith from Global News. Does this declaration move the city's stance on operating the TTC at full capacity? Does it make you think to lower the expectations of what the TTC can deliver because of it being such a sort of the last sort of bastion of big place for large crowds to gather? Does this change the city's TTC plan?
I saw a picture on one of the websites today of a TTC subway car that certainly didn't look like it was on a weekday. There was hardly anybody on it, and people were spaced out very generously and in compliance with the rules. I will only say that these are the kinds of things that we're looking at all the time. We have kept service levels to the normal service levels because we wanted to make sure that the health workers and all of the first responders, people looking after our elderly citizens, could get to work. So that is our continuing policy. It is costing us a lot financially, obviously, to continue to provide full service when we're minus, say, $20 million a week on revenue. But for the moment, we're continuing with the full service. And obviously, one of the things the medical officer of health will be watching, as will I, is the crowding levels on the transit. And at the moment, by keeping full service, by allowing people to enter and exit via all the doors, we are actually reducing the possibility of crowding and reducing the possibility of close contact between people. And so that is the policy as it stands, and we're always looking at these things every day as things change.
What's your message to the citizens of Toronto and frontline workers? With a declaration like this, you said you don't know when the last time this was done. It's a big move by the city. A lot of people feeling a lot of angst and fear. What's your message to the people?
I have two messages for people. The first one is to have people know, especially those people who continue to go to work. You know, my daughter is a doctor, and I talked to her this morning, and I confess I was worried about her because she's a doctor, but she has to go to work because she's a doctor. And that's what doctors do, and nurses and people who work in hospitals. And thank God they do that work for us, and all the public health workers that are working, and all the people working in shelters, and the people working in long-term care homes. They're heroes for us right now. But I say to them, we are doing everything we can to make sure that they are kept safe. That's first and foremost. And I think that the other thing that we're trying to do, which really is for them as well, is to make sure that this ends as soon as possible, because they're under huge strain, leaving alone the risk that they're under. And the best thing we can do, all of us collectively together, is to get behind this effort to wipe this thing out by doing what we have to do on social isolation and on social distancing. The other message I would have for people is this: have a sense of hope about this. I mean, we have been through difficult times before. There are people in a generation before mine that were through times that were maybe not as close to home, but were terrible, terrible times of sacrifice and people losing their lives and so forth. And people have stood in there in that and other things that have happened since then. This is a great city full of strong, resilient people, and we have to give each other hope. And, that doesn't mean you should cross the sidewalk to give your neighbor a hug. You shouldn't do that, but it does mean you should, acknowledge your neighbor, make a phone call to them, check in on somebody who's older. If you can save an extra trip to the store by doing something for your neighbor, to pick something up for them, then that's all for the good. So I just think those are the two messages I would give. We have the backs of the people who are heroes for us right now, and we want to encourage people to have a sense of hope that we'll get through this. And the more they cooperate, the faster we'll be through it.
Michelle, Canadian Press.
Hi, can you hear me?
Yes.
Hi. Quick question, just to get maybe a little more clarity on the distinction between the provincial and the municipal declaration of emergency. Would you be willing to provide a few examples of the sorts of measures that the province's declaration had not covered that you now may be in a position to act upon when needed?
Well, I think had they not, for example, issued the order that they've issued together with the list to come, I think you would find, and I don't want to put any words in your mouth, you can ask her, but I think you would find that the medical officer of health would have given some recommendations in all likelihood that were similar to what she did initially with restaurants and bars. And you'll recall that the opening chapter there was the City of Toronto Medical Officer of Health moving first to say, I'm going to make recommendations, but I'm also going to follow up as my authority permits me to do on an individual basis to enforce those orders. But I think that sent a very strong signal of leadership. It caused a lot of people to act voluntarily, and there was surveying activity that went on after that to determine compliance with that. And I think that you would find that just our feelings were so strong about what's going on in the City of Toronto, which is the area that she and I and Chief Peg and others are responsible for, that had the provincial order not come, we would have probably made some strong recommendations in that regard. But you'll have to ask her about that. What I wanted to do in the context of what they asked me to do was to sign this declaration that gave us the flexibility and made us as nimble as we can possibly be, so that as she and Chief Peg and others discover things that we need to do on an urgent basis, we will have the maximum degree of flexibility possible to act as quickly as possible and therefore as effectively as possible. Because I think, as we're saying to people, individual people, time is of the essence. This is the key time. The numbers are changing. They have been changing, as people have seen, for several days now. We are hearing of community contact. We have thousands of people who came back from traveling just in the last couple of days. Now is the time for us to act as individuals, but now is also the time for government action, which you're seeing on all fronts.
Michelle,
Thank you. And I realize the measures are hypothetical at this point, but would this theoretically now empower you to impose things like curfews or suspend mass transit service?
I think the provincial order certainly will allow them to do that. We're going to be engaged in close consultation with one another about things like construction sites, because I've been out doing a lot of consulting, as has the Premier. I know there are quite a few people that have been in touch with us both. I can't precisely answer the question about a curfew, but there's been no discussion of that because, frankly, there's been no need for it. And if people follow the advice that they've been given in terms of staying home and minimizing trips outside the home for any purpose, including shopping and otherwise, there'd be no need for a curfew because it means there'll be nobody on the streets. I want our streets. I was told today that Avenue Road, and I couldn't see it from where I live here, although I live fairly close, I was told that Avenue Road didn't look that much different than on a normal day. I want the pictures, not because they bring joy to me, but because they will bring satisfaction that people are paying attention. I want streets like Avenue Road and the Danforth and Yonge Street and Kipling and McCowan to look like the streets that we see in the pictures from other parts of the world. And while it's not a happy picture, it's a picture that tells a good story about people saying they're doing what they've been asked to do and staying in home, staying around home, not going out any more often than necessary. That's what we want to see, and I don't think there's a need for a curfew order to make that happen. I think people, if they follow the rules, that's exactly what will happen. There'll be nobody on the street.
Mark McAllister, City News. Go ahead.
Mayor, I think you've answered pretty much every question that I would have had. Thank you.
So
Anybody else?
Oh, Colin at Radio Canada is next.
Can you just repeat well, if you can, I appreciate the French, but can you just repeat why it's so important to stay home in French, if you could try, please?
Si nous allons rencontrer les autres citoyens, c'est un grand risque pour transmettre le COVID-19. C'est un grand problème. Et maintenant, nous avons beaucoup de citoyens qui continuent d'associer avec les autres citoyens. C'est un grand problème pour nous. Et maintenant, l'ordre du Premier ministre Ford et l'autre ordre de la ville de Toronto peut-être aider convaincre les citoyens de changer leur behavior.
And I
My
think
best try for today without notice.
we have one more question, I think, at CP24.
Hi, Mayor. Jamie Goodfreund again. When it comes to the state of emergency and the powers at your disposal, what are some of the major decisions you can make without having council's approval? And are you considering?
Well, I can make any decision. What this does is gives me the authority for a period of time. I think it's about 30 days, and then I have to account to the council, plus I think it's about 30 days, and I have to account to the council after that, which I'm quite happy to do. But in that time, it allows me to make any decision the council could make. And so I will not hesitate to do that. I'm going to do it, as I said, upon advice, which includes advice from city councillors and from senior officials, and of course, most importantly, from our medical officer of health. I will do it in consultation with the Premier and the Prime Minister and the other governments. But I will not hesitate to make decisions that I'm told by these professional experts are necessary to stop the spread of this virus. So whatever it is within the power of the City Council to do, I am given the authority to do that, but obviously I'm conscious of the need to do that with great care and with great diligence, and I will do that. I think people know that of me.
And Mayor, with the increase in confirmed cases, with recent death in Toronto, and with just the sheer irresponsible behavior that a lot of people are demonstrating, when it comes to your discussions with the Premier and the Prime Minister, has there been any discussion about a red line that, if things get to a certain point, that we have to start considering taking away some of the civil liberties of the people of Toronto?
Well, we already have taken away civil liberties in some respects. I mean, when businesses are ordered to close, that affects the civil liberties not just of those businesses as entities, but also of the people who run them and own them and work in them to some extent. So I would just say, look, I will tell you from my conversations with the leaders of the other governments and the people, the senior ministers and others, great care is being taken in all of those discussions to balance not only, of course, you've got the health consideration, which is number one at this moment in time, but to balance against that people's individual liberties, the impact that it has on the economy, and all of the things you'd expect to be taken into account. And I've been incredibly impressed at the degree to which all of us have been able to have these discussions together in a collaborative, cooperative way, but always taking into account the full public interest. And the public interest, of course, at this moment would place health number one, but there's a lot of people, for example, very concerned about their finances and their economic and employment future, and we're discussing all of those things when we together discuss these decisions that could be taken or not. And so I just want people to know that any decision that's been taken to affect people's rights, it affects your rights to have to distance yourself from 5 meters from somebody else. It affects your rights to not be able to go shopping at a given store on a given day. And so every single one of those things, I assure you, from having talked to the others, has been done with great care and extensive discussion that balances out all the different considerations that we have to take into account in making what are very difficult decisions. The Premier said it. These are not decisions you make lightly, but they're ones you have to make because that's what people put us in these offices to do.
Okay, thanks, everyone.
Thank you very much.